introduce our next JCI Makati Princess Urduha's very own member, Dr. Emmy Kua, who is also from the Philippine General Hospital.
Good evening, ladies and gentlemen. Today marks another Good evening, ladies and gentlemen. Today marks another day for some of us here in Manila whose barangays will be under lockdown tomorrow. Around this time last year, we were told by our government officials that this pandemic will end when the vaccine arrives. Now that the vaccines had actually arrived, why are we getting a higher number of infected individuals, even amongst our own families? And now we are actually having many variants of the original COVID-19 strain. So tonight we have an opportunity to interact with someone from the front line. She is a clinical associate professor of the University of the Philippines, Philippine General Hospital, and heads the Division of Adult Medicine since 2016. She chairs the Hospital Infection Control Unit since 2004 and chairs the Antimicrobial Stewardship Committee since 2016, the executive director of the UP Prime TB Dots program since 2010, and she chairs the Blood Infection Committee since 2010 as well. She graduated from the University of the Philippines College of Medicine and took her internal medicine residency in the Medical College of Pennsylvania. She underwent further training in infectious diseases in the Philippine General Hospital and took a master's in clinical epidemiology at the UP College of Medicine. Among her numerous awards include the 2019 Presidential Award from the Philippine Society for Microbiology and Infectious Diseases, Ripple Awards 2019 Individual of the Year Award for HIV Advocacy from Love Yourself and UNAIDS, Exemplar for Research from the Philippine College of Physicians 2019, and the UP Alumni Association Distinguished Alumni Award in Health Research and Education in 2018. She had authored multiple infectious disease prevention protocols for the Department of Health and the International Clinical Epidemiology Network. She's a mother to 7 wonderful children, and the eldest of whom is a medical oncologist in training. She is also a PADI certified advanced diver since 2010. She's the face of the Philippine General Hospital in our battle against this pandemic. It is my honor to welcome a person who had inspired me in my career and in my life, my sorority sister and mentor in life, Dr. Regina Berba.
Hello, everybody. Let me share my slides muna. Wait lang. Okay. So, it's really a pleasure to be with you tonight. So I'm going to rapidly go through most of the slides I show to audiences like this one. So you asked me to talk about the COVID, the variants, and a little bit about the vaccines. So this lecture was made and intended for you members of the JCI. It's based on many things that we do at the UPPGH, and I hope you can be able to increase awareness about COVID-19 prevention and control with your family's friends and other loved ones. I declare no conflict of interest. And actually, Emmy and I belong to in the bottom of this list of my affiliations. We belong to the Mu Sigma Phi sorority, and that's where I met Emmy. So I'm very proud of that too. Okay, so what do we know about the virus and how it spreads? So siguro you're very familiar now with the spikes, diba? The novel virus is called the corona because of the spikes. But these spikes are very important because it's very characteristic of the coronavirus. The other viruses, yung dating SARS, tsaka yung dating MERS, parang mabilis lang siya nangyari sa world, no? But the SARS CoV2 is a little bit more different and more difficult to control. So in this diagram, you see the spikes manifested here with the parang pentagon siya, no, na blue-green. But that's very important kasi it's that parang siya yung key that looks for the lock, and this key and lock is the one that opens the cells, our cells, to the invasion of the virus. So you would see here that the virus goes around through our bloodstream, looks for particular cells with the receptor, yun yung lock. Tapos nakaka-form siya ng key and lock mechanism to unlock that pathway that allows the entry of the virus into our cells. So parang ganyan siya. So as important as it is in the drawings that we see of the spike proteins, yan talaga yung very important in the invasion of the virus and allows us to get sick because of the virus penetration into our cells. But the same spikes are the ones that have been used by many scientists to create the vaccine. So yan rin yung pinaka-core ng control natin. It's through the spikes, nakikita nyo yung picture dito, yung parang mga Y-shaped particles. Those are your antibodies. Tapos it is naman through the lock and key mechanism na yung antibody looks naman for these spike proteins. At saka it deactivates the viruses. So as important as it is to creating the illness, it's also important for the development of the vaccines and for the mechanism of the vaccine and how it helps us produce antibodies. Okay. So because of this information about the structure of the virus, many scientists and companies across the world have started looking for the vaccine options. At saka marami ng platforms. Kasi it's important din na maraming companies ang nagpo-produce nito. Kasi millions and millions and millions of people do need some kind of vaccine. And it requires many collective effort of many companies to bring this together. So whatever picture you see of the coronavirus, parang ganyan talaga itsura niya. No? These ones are parang micrographs of how the virus tries to invade the lung cells inside human hosts. Okay. So about transmission, dapat very clear na po to sa atin, respiratory droplets. And human-to-human transmission from one person to many persons. Skip ko na siguro to. This is a video that I initially thought of showing you, pero sige, pakita ko lang sandali na how easy it is to get infected, diba? Sandali ka lang walang mask, pwede ka ma-infect. Kasi pwedeng somebody coughs, sneezes, exhales beside you. So, sandali kang may mask, yung mask nasa ilalim ng chin mo instead of protecting you, ma-infect ka na. Pero even vulnerable people, if they're wearing masks, pwedeng hindi ma-infect. Okay? So, yun yung message nitong short film, that it's very easy to get the virus, but there are ways to prevent the virus from infecting you. So here's another picture that I hope pwedeng magstay with you in your brain's cells. Na pagka may isang tao na may infection, ganito siya. Kahit humihinga lang siya, panay niya kayo pwede ma-infect if you are close enough to that person and not wearing the masks. Okay? So, depende sa ginagawa ng person na infected. Kung humihinga lang siya, pwedeng hanggang 1 to 2 meters, diba? Pero kung very active siya, kunyari, vigorously jogging, tas kasama ka niya nag-jog, or sa exercise gym, so ang lakas niya huminga, or tumatawa siya, or kumakanta siya, or hollering at the top of his voice, or nagsisneeze, nagka-cough. So yan yung mga activities that can make the droplets go further out. No? So kahit medyo malayo ka, baka ma-inhale mo yung kanyang droplets. So again, depende sa how turbulent that cloud that infected person creates around himself, the distance of the travel of the respiratory droplets may vary. At saka yung speed, no? Yung strength. So it's very important for us to recognize this and constantly protect ourselves. So ito, baka nakita nyo na to baka before. So it just shows us na totoo yun. Totoo yung pag wala kang mask, dalawang pwedeng mangyari. Kung ikaw yung infected, nalalabas mo talaga yung droplets into the air around you. At kung ikaw naman yung susceptible, ibig sabihin, wala, nakatayo ka lang dun around people who may have the infection, pwede mo mahinga tong mga infectious droplets na to. And you would see here na sometimes the very thin cloth masks do not work. Okay. And then there's the question of whether the environment contributes to the COVID-19 transmission. So maybe a little bit, not as significantly as the respiratory droplets, but certainly kung nahawakan mo, you held on at napunta siya sa kamay mo, tapos napunta yung kamay mo sa mucous membranes mo, let's say nagpick ka ng nose mo, so napunta na siya sa inside your nose, pwede na siya maka-infect sa'yo. So, in general, we just say, dapat lang maglinis ng mga areas. Don't wait for a positive person to contaminate your surroundings before you clean it. You constantly clean it. And this picture naman just tells us na really, there's no other way for that virus to enter our body other than ma-inhale natin siya. No? So it's through our respiratory tract that enters and gets into our lungs. Yun yung entry point. So for most part, it's breathing it, eyes, nose, and mouth. No? Yung eyes, kaya tayo nagfa-face shield para hindi maging open yung mucous membranes natin. And then what are the symptoms? Ini-include ko to by now. Iniisip ko lahat ng tao alam na to eh. Pero repeatedly, sasabihin ng mga tao, ay, hindi ko po naisip na COVID-19 na pala yung lagnat ko. Or, oh, I didn't think my cough was COVID-19. Eh, ano pa naman ba naman sila? It's really a strong possible diagnosis when you do have this in the height of the pandemic. So again, merong mga mas madalas mangyari, tsaka hindi masyadong madalas mangyari. So when you have cough, fever, chills, pag parang excessively pagod ka, masakit na masakit yung ulo mo, and parang different yung degree of sakit ng ulo, not your usual headaches, sore throats. Yan. Huwag nyo na hintayin na meron kayong nahihingal kayo kasi that's a misnomer and a misconception na kailangan maghintay ng shortness of breath. So here it is in English, if you're more familiar with English, and in Filipino. So mahirap huminga, nag-uubo, lagnat, parang pagod pa na, masakit ang ulo, etc. etc. So the other thing na kailangan natin maintindihan is kailan ba pinaka-infectious yung isang person? We always say about 14 days kasi yung incubation period. Pero pinaka-infectious siya at the start. Yan, dun sa pink, no? Yung 0 yung day na nagkalagnat ka or nagkaubo ka or nagka-sore throat ka. It's just around that time that you start really getting infectious. So mali rin yung sige, hintayin ko next week kung meron pa akong lagnat tsaka ako magpapatest. Or mali rin yung, I'll still go to work. Hintayin ko yung resulta ng aking PCR test. All of those actions are wrong. The moment you feel some kind of illness, feeling sick, parang tatrangkasuhin, stay at home ka muna, inside your room, mag-isa. So, self-quarantine na. Para sa ganon, or ang tamang term ay self-isolate. Para wala ka nang mahawa. Kasi nga, pinaka-infectious ka about half a day before and the first 1 to 3 days of the symptoms. Not when you're already short of breath. That's about 7 days away. Hindi na. Loob na yung virus sa inyong katawan noon. Naka-infect ka na ng maraming tao. So, here's just a drawing of from head to your mid portion. Lahat yan pwede ma-affect ng virus. Okay. So what happens to our patients? So it's true na most people are mild and just a few get severe or critically ill. No? So sa Philippines, parang ganito yung picture. Nakasulat dito sa baba, and this is from the DOH, about 4% are asymptomatic, never had any symptoms, and a lot are mild. So sinasabi ng mga economists, ang dami naman mild, bakit naman tayo kailangan mag-lockdown, get everybody without jobs because of this 1.4 plus 1.4%. But when you think about it, when millions are already affected, like globally, millions and millions and millions are affected. Millions din, yung 2.8 na yun, madami rin lalabas yun. So severe is when you start having breathing problems, when you start to need oxygen, or when your x-ray starts really showing bad pneumonia. And this sometimes leads to you requiring staying in the ICU with many invasive procedures. So there was an open safely study that happened early last year pa nga to nung April last year. And what did they mean by severe illness? Sino yung nagkaka-severe illness? So nakita nila na pag mas matanda ka, mas malamang mas severe yung illness mo. So very different yung performance ng mga tao na mas matanda na 65 years old versus those who are younger. So on the right side are Kaplan-Meier kinds of graphs. So ito yung parang kikita nyo, iba-iba na yung graphs, no? Sa related deaths. So mas likely ka mamatay kung nandun ka nagbibilong sa 80 and older. And then as you grow, as you are younger and younger, parang hindi masyadong issue yung death. Gumagaling ka. And similarly, there are groups of people that have higher risk for bad outcomes. No? So yung mga matataba, yung obese, yung may high blood pressure na uncontrolled, yung merong mga chronic lung disease, so ito yung mga may emphysema, chronic bronchitis, smokers, yung may cardiovascular disease, yung may congestive heart failure or heart problems, and then other kinds of people whose immune system might be lower, yung may cancer, you would see here, risk of death is 56% more. Diabetics, 136%. Sobrang taas ng diabetes. So if you're one of this, kailangan you try to really control kasi hypertension and diabetes, madali lang. Well, usually madali lang siya makontrol. And some other illnesses. In terms of numbers, ito siya. No? Just trying to say na, oo nga, may mga conditions na kahit hindi ka pa matanda, pero you have them, you might be at risk for severe outcomes in COVID-19. So these are what we call vulnerable groups. No? So WHO says 60 and more plus those with lung, heart, diabetes, and other similar chronic conditions. Tapos yung sa right, yan yung DOH. So 60 rin yung tinag. So pag senior citizen ka na, plus comorbidity, yan na yung baka mas mahirapan. So as Beverly said earlier, ito yung mga prioritize ng vaccine program. No? So we need to protect our vulnerable populations. So just quickly, mga rules 1, 2, 3, 4 lang to. Again, social distancing, diba? Physical distancing. Kasi ito yung talaga mangyayari kung hindi tayo mag-physical distancing. Kahit na sabihin mo ngayon ka pa lang papasok sa work, kung we don't follow physical distancing, going to have problems. So keep that at the back of your head. Number 2, of course, wearing mask. So pinakamahalaga, physical distancing. Number 2, pinakamahalaga is wearing face mask properly. Here's the do's and don'ts. I leave this slide set with Emmy also. So you can take a look at it. Pero by now, dapat medyo alam na rin natin to, diba? Yung face mask, kailangan pati ilong naka-cover. Kasi sabi na nga natin kanina, dyan pumapasok virus. And avoid touching your mask also. Kasi baka hawakan mo na yung virus sa environment. In general, cloth masks are okay. Basta 2-layered siya. Kasi nakita natin kanina kung 1 layer, parang malabas pa siya. And rule number 3 is hand hygiene. There's a right way and a wrong way. Pero essentially, basta hugasan mo yung kamay mo as often as possible or carry the alcohol. Yan. So kung mga bosses kayo sa workplaces nyo, make sure may alcohol around you. So post reminders, put actual alcohol around the desks of your employees. Yan, and ask them to have a bottle of alcohol. And also make sure somebody cleans all the surfaces. Huwag nyo na hintayin na may isang mag-positive sa inyo, tsaka pa lang kayo magla-lockdown para maglinis. Cleaning must be routine for all of the workplaces. And those in the hospital, medyo mas malinaw naman yun. Plus in your homes also. Even if there's nobody documented to be positive in your home, make sure that somebody cleans all the surfaces. Ngayon, you know that, so here at this point, I'll share with you some experiences of PGH talaga. Hindi ko pa ito masyadong sinishare sa ibang people, but I thought maybe for your group, this might be useful. So sa PGH, we have some what we call mobile staff. So ito yung mga pumupunta sa iba-ibang wards kasi yun yung nature ng kanilang work. So kunyari ito yung mga engineers na magmamartilyo sila sa ward 1, tapos punta sila sa ward 2, ward 3, ward 4. Yan. So hospital staff who move throughout the hospital. So even if just one person is that infected, kung hindi nyo siya talaga ma-identify, eventually lahat ng tao mai-infect. And this is proven by genomic sequencing. So nakita namin na itong si number, yung brown person, na-infect niya si yellow person, na-infect niya si blue person, si green person, at lahat yan pare-parehong klaseng virus proven by genomic sequencing. So babantayan nyo bawat isang tao, lalo na these people who work throughout the hospital. Number 2 cluster, we saw na may carpool nga. So parang it's saving a lot of money. Pero within the carpool, dapat mag-mask. Kasi here, actually mga family members to. So hindi totoo na pag family member, you already have a sure, safe bubble. No? Kasi it's possible that one person in that carpool got infected. Tapos na-infect na niya lahat ng tao kasi matagal sila magkakasama sa carpool. They traveled from PGH to, let's say, they live in Cavite every day, diba? So, matagal silang nagkwentuhan, nagkakainan, nagtatawanan. Tapos along the way, they shared na rin the virus. And see what happens if even just one person gets infected in that. Pag pumasok siya sa work, ganyan na talaga kabilis. And they're all essential workers, so they need to come in every day. So ganyan na nangyayari kung hindi tayo careful. So we need to watch out for people who get ill along the way. Kahit na mild lang, kailangan talaga sila mag-isolate. And cluster 3 is inter-office movement. So may mga taong kakain sa Office A, tapos kwentuhan, punta sa Office B, kwentuhan ulit, punta sa Office C. Ngayong pandemic, dapat di natin to ginagawa kasi nakakahawa talaga. Lalo na kung walang mask. And cluster 4, ito yung reason why hindi na kami nag-workshop face-to-face. Kasi there was one workshop where unintentionally, hindi niya alam may sakit na pala siya. So, yun. Meron siyang feeling weak, some headache, but didn't recognize na illness na pala yun, COVID na pala yun. Na-infect niya talaga lahat ng tao dun sa workshop. So, yun. So, fortunately, mga young ones naman yung mga staff ng PGH. So, lahat to ay na-prove by whole genome sequencing and we could like map it out in the hospital. So fortunately, as I was saying, most of us are healthy individuals in the hospital. So we sort of just got over the infections that we've seen. And actually, nung February this year, we decided to just see where we were sa buong ospital. So we invited people to come voluntarily for antibody testing. Yung antibody, di ba kanina nakita natin merong antibody na na-produce pag nagkaka-infection ka. So we measured this. Kasi dapat wala kang SARS COV2 IgG kung hindi ka nagkasakit. So dapat yung IgG mo non-reactive or negative. No? So, ang ibig sabihin po ng madaming numbers na to, yan, yung next. So, kung ako, gigradean ko yung PGH, okay ba kayo? Tama ba yung ginagawa nyo? Were you able to protect your staff? I would say that time, nung February, we were doing very well. Kasi ito parang grade 2 for the whole year, yung 2020, March to February. So, ang grade namin was 74%. So, sa akin, parang B plus yan. So, 74% kung 5,000 people to. This was something like more than 4,000 people. We're still COVID-free and we're a really heavily burdened hospital. So, baka maayos yung aming mga patakaran. So, we found out na basta tama yung PPE suot, kasi meron kaming mga level 1, level 2, level 3, level 4, hindi siguro may infect yung healthcare workers. Basta sapat yung PPE. So I always tell this to people in the community, basta tama yung pagsuot mo ng mask tsaka face shield, kahit na may katapat ka na tao na merong COVID. Kasi ito sa PGH, tapat-tapat namin talaga yung mga may COVID. Pero naka-PPE kami, hindi kami nahahawa. My antibody level is 0. So I never had the infection in the entire 10 months. So how do our healthcare workers get sick? And this is from a reference from other parts of the world. Pareho tayo nang na-experience pag naghuhuntahan ng walang mask outside the ward. So, nagwo-work sa office, sa library, nagkakainan, yan. Or nagko-commute, or with family without mask, di ba? Or friends. Yan yung likely magka-transmission. So, there we were. Ito yung parang epic curve namin from April to December. You would see na at some point talaga, merong mga nagkaka-infection. Yun yung mga clusters na pinakita ko sa inyo kanina. Pero towards November, December, January, February, nag-low na kami talaga. Halos wala na kami nakita infection. Pero medyo iba yung nangyari ngayong March. No? So we felt a new surge this March. So, ayaw na niya mag-move. Sabi, stop na daw. Oh no. Wait lang. Okay. Okay. Wait lang Hold on. Nagsa-stop yung computer ko. Okay, siguro. Okay. Sorry. Nag-close yung aking PowerPoint. Sorry guys. Wait lang ah. Siguro I'll restart. Maybe you can muna. Wait. Sorry guys. Wait.
No worries, Doc. Take your
I'll stop.
time.
Yeah. So, hindi ako maka-open ng video kasi.
Are you in duty,
Kasi-
Doc? Were you doing rounds a while ago?
Yeah. Hindi, ngayon kasi, wait lang wait. Sorry. Nag-stop talaga yung aking.
Sure,
Yeah,
Doc.
but I'm isip na kayo ng mga tanong nyo.
Yeah,
At Emmy, magkwento.
correct.
Habang-
I'm sure a lot
habang-
of our participants, we have over 230 participants or more pala right now. Maybe I can call Sam Jasper, SG Jasper on screen with me
Hey,
while we're waiting for
hi there.
Doc Berba. Hi, Seth.
Hey, Dr. Berba, relax lang kayo habang nire-ready niyo po yan.
Yes, Doc, no worries.
It's all right.
Sometimes it happens.
We're just,
This happens talaga.
okay lang
So,
po.
kaya ako hindi maka-on ng video kasi nasa car ako.
Oh, wow. I hope you're not driving.
Multitasking.
We hope
No,
you're
I'm not
driving.
driving.
Okay, good.
Except,
Take care, Doc.
except kasi po,
Quiet.
hindi naman ako nagmo-move. Nasa car lang ako. Kasi,
But you know,
kailangan ko nakakonect yung aking.
you shared a lot of very,
So-
very enlightening, it's been...
Can I also join?
Yeah, please.
Ay,
Hi,
kwento
Seth.
muna ka.
Hi, Seth. Hi, Direct Faith. Nagselos.
Hi again.
Then, just
Oo.
kidding. Carry on, Sen. Carry on, Sen, Jasper.
No, okay lang. Actually, nakaka intrigue, and
Yeah.
kasi, just when you thought that you know everything there is after a
That's
year,
true.
it's interesting how a lot of these numbers just really come in and get more detailed as we move forward. But that
Yeah.
being the case, no, I think it's really there's really no question about whether or not you get vaccinated. I think people really need to change how they do things, and safety has to really be a totally different standard at this point in our lives, diba? Kaya okay to, nakakatuwa na nakakapraning, but
Nakakapraning. And honestly, it's, really making us, for all the participants here, I'm sure it's really making us want to protect ourselves more
yeah.
and really stay safe.
Yeah, I mean, it's amazing because before March last year, when you stay safe, it's a joke. It's a joke for dates, but now stay safe is
Yeah.
Stay safe is something that happens to be said in a much more urgent,
Meaningful
context.
way.
Yeah, in a much more
True.
meaningful, more urgent context.
Actually, Sen, have you noticed there are no statuses on Facebook anymore that says feeling sick?
Oo nga, no?
I'm sure that
No, but that's true. That's true. In fact,
Sige, subukan mo mag-post.
a lot of people are now much more careful about declaring
Yeah.
themselves unwell.
Yeah. Yeah.
Kasi-
Even at work, no? No one's like, boss, I feel sick I think I have a fever. Wala na.
Wala na.
Di na pwedeng palusot.
Hindi lang yun, especially if you live in a town with very strict local government, wherein they have strict quarantine procedures and everything. Like right now, I'm in Baguio, and our LGU is very, very strict. So, oras na may sakit ka, you're gonna get quarantined. Alam mo yun, may woo,
Yes, that's correct.
ambulance right there. And then
Mm.
parang, kulang na lang hihilahin ka off the door. I don't want to go. I don't want to go. But, oh, I think Dr. Berba is
Galing.
Yes,
Oh
Dr.
yeah,
Berba
she's
is
back.
Uh,
Ayan
Hello, Doc.
na, okay.
Dr. Berba, are you
Thank you
good?
for...
Sige po, we'll give the screen
Yay.
back to you.
Yay.
Thank you.
Okay.
Okay. Sige. I'll continue. My kwento about what happened to us. I hope my slides work. Parang napagod na yata yung computer ko. Ayan. So,
Na-infect yata,
we
Doc.
already reached the point. Ano? Yan. So this is
Back-
what we
yeah.
call an epi curve. So we come out with our daily reports showing kung ilan na yung patients sa amin. So you see here, over 3,000 na yung naalagaan namin through the year. Yan yung 2,947. Tapos ito, kita nyo yung parang bumaba na kami ng mga November, December, January, February. Tapos biglang ang taas na naman namin ngayong March. So there was a surge that happened internally sa PGH. And this happened even before the country felt it. So when we looked at the world, parang sabi namin, parang hindi naman masyadong nag-iiba yung world, but what's happening inside PGH? So we know now na more than 120 million and more than 2.5 million deaths. Ang dami na ring vaccines. Pero pagtingin namin sa Philippine data, parang oo nga, tumataas din pala yun sa country, no? So ito, looking more closely at what's happening. So, nung konting-konti pa lang yan nangyayari, parang nag-umpisa pa lang tumaas. So, we were seeing 5 cases nung March 3, tapos 7 cases nung March 4, which was already very high for us kasi we came from yung mga 1 to 2 na lang every other day. So, parang nag-release na kami ng alert, everybody, make sure you're following everything. Tapos dumami pa siya through the next few days. So we released another alert, and a fourth alert over a really short period of time. Kasi dito sa short period of time na to, more than 150 people na yun na-infect. Ang bilis-bilis. So we were wondering what was happening to us. So we felt na ang two main reasons behind our internal surge was that people were coming in, ito yung healthcare workers ang ibig sabihin ng HCW. People were coming in despite feeling some symptoms. Tapos minsan hindi mo talaga rin sila masisi kasi nga that's the nature of COVID-19. It's sometimes very mild, konting sore throat, konting ubo-ubo. You can't even distinguish it from an allergic rhinitis if you have something like that. And then when these people eat with others, they remove their mask, they infect others who eat with them. So we computed na for every one person who comes from the community, probably will infect 4 to 5 other people inside the hospital. So we needed to stop those behaviors and activities. So we said, oh, please naman, pag may sakit kayo, wag na kayo pumasok. At saka do not eat together while at work. So sa PGH, bawal na ngayon magkainan sa isang office sabay-sabay. We stagger ourselves when one is removing the mask, others won't eat, or we go outside our office. Tapos yung cafeteria, magkakahiwalay na talaga. Masungit na yung mga tao, hindi na nagkukwentuhan. So that's a strategy to just stop this. But we wondered whether there was the variant of concern, that's VOC, no? So, di ba, minsan baka nakita niyo na rin to na really, ayaw niya. Oh. really, when you eat and you remove your masks, whether in your office, or in the mall, diba? Then you can get the infection there. So you need to plan out your eat outs or your trips, kasi these are high risk activities. So that's what we realize in PGH. Wait lang. Pero we didn't know, we were told later on by DOH na meron pala kami nagkaroon ng South African variant among our patients. And then later on, we found out there were more South African variants and more UK variants. So that explained why we were feeling this rapid change. And I think this is what I wanted to show here. Kung dun sa barangay nyo or sa city, sa community, sa workplace, you suddenly feel a surge na parang sinisisi tayo ng government kasi hindi na daw tayo sumusunod sa lahat na sinasabi nila. Pero maybe there's that component of the variants. No? So that's important kasi over time, we saw na dami na palang variant. And maybe that explains it. So it's very important for you who are listening to me na when you feel any kind of illness, to stay home in isolation. Minsan nagsistay home tayo, di tayo pumapasok, pero pumupunta naman tayo sa mall, bawal yun. O minsan we stay at home and then we play with our children kung may anak kayo. So bawal din yun kasi mahahawa nyo sila or with your siblings or parents. Tapos merong nagtatanong, what about the asymptomatic? Meron talagang asymptomatic. That means nagka-infection sila pero hindi talaga nila naramdaman. Pero wag na natin masyadong isipin yun kasi that's really going to consume us and consume a lot of resources trying to find them. Basta we know they exist, kaya nga kailangan we're in a pandemic mode, no? Pandemic precaution ang tawag doon. We're following all the precautions all the time, regardless of where you are. Kunyari nasa ano kayo, nagko-commute kayo, dapat hindi kayo umiinom na iced tea or milk tea or with pearls kasi that means tinatanggal mo yung mask mo at some period in time and you shouldn't do that kasi we're in a pandemic. We're really in a high surge right now. And I show this again kasi I think your group, some of you may be managers, supervisors, maybe employers, maybe some of you may be at the top of it. So there's a hierarchy of controls. The higher it is here, we start with engineering kasi hindi mo naman ma-eliminate at ma-substitute yung virus. Pero surely sa workplace nyo, you could introduce controls na engineering. So improve ventilation, create policies, tapos makikita nyo yung PPEs which is very behavioral driven. Kailangan 100% na nagpo-follow ng PPE. Ang hirap yun i-follow. Siya yung least effective. And yet, it feels like our national, well, baka mapagalitan ako, but it feels like parang it's up to you, di ba? PPE yung parang pinaka-strong. Pero dapat talaga we're higher than that. So that's what we're trying to do in PGH. And that's what I want to tell you guys na when we're trying to control something as widespread as this, dapat systems approach. We work through improving workplaces, our transportation systems, our community services, our public places. And make it easy for people to comply. So and adding that layer of protection of vaccines, no? So kung kailangan ba talaga magpabakuna, sana naman na-convince na kayo ni Beverly kanina. The answer is yes kasi it provides another shield, no? Yung sabing several layers. So yes, the answer is yes. At the next few slides really just tell us na wala nang other answer other than yes, it's necessary for us to have at least some chance to stop the epidemic, the pandemic. So are vaccines necessary? The answer is yes, kasi it offers one of the ways we may be able to end this pandemic. So this is herd immunity. Di ko masyadong nakita kung napakita to ni Beverly pero just to stress na kung ito yung hindi tayo nagpapabakuna, yung blue, nandyan tayo, yung PGH nandyan yan nung nag-surge, hindi pa madami yung nababakunahan. Kahit isa lang yung may sakit sa atin, the barangay might eventually be all infected. Dito yung blue, yan yung konting na bakuna, ay yung yellow pala. Yung blue yung unvaccinated, yung yellow yung vaccinated, pero konti pa lang sila. Eventually, everybody will become red, no? Mai-infect. So we need to target 70%. Most of us are vaccinated para ma-protect everybody. So ako nagpa-AstraZeneca na ako nung it became available to us. Okay. So the next slides will tell us na pagka ba may bakuna, 100% sure na tayo hindi tayo magkaka-COVID, hindi pa rin. No? So there's that reduction in risk pero hindi kasi 100%. So we need to continue the apat-dapat or everything else we're following right now. Okay. And then many people still are not sure kung papabakuna or hindi kasi not sure kung safe or effective. Pero the answer is overall, the COVID-19 vaccines are safe and effective. Basta sinabi ng FDA okay siya, then believe, trust. Pero may certain populations na may contraindication. Contraindication means bawal. So sino yung bawal magpabakuna? Ang answer ay the only absolute contraindication ay kung may allergy sa vaccine. No? So meron position statements yung yung Professional Society for Allergy at sinasabi niya na ito yung main contraindication. So kung may allergy ka, don't take it. Paano naman natin malalaman may allergy tayo? Hindi pa naman tayo nagpapakuna. So people, kasi 2 doses eh. Kung nagka-allergy ka sa first dose at severe yung reaction, don't go for the second dose. At saka kung nagka-allergy kayo dito sa mga laman, contents, yung substances inside the vaccine, and they've identified that kung nagka-allergy kayo before to those, wag na rin. So again, mahalaga kung nagka-allergy sa first bakuna, don't go for the second bakuna. Or yung mga nagka-problem sa some specific medical instrumentation like yung colonoscopy kasi yung laxative pala doon parang may components similar to the components in the vaccine, or surgical gel allergy or graft allergy. What about kung nagka-problema ka sa other vaccines? Let's say nagka-flu shot ka before tapos nagka-allergy ka. So hindi siya absolute contraindication pero baka dapat magkonsulta sa specialista kung meron kang history ng severe reaction to something in the past. Okay. Ibig sabihin lang, as Dr. Beverly said kanina, mas matagal kayo oobserbahan. Okay. What about yung mga allergy sa kung ano-ano? Di ba minsan may allergy tayo sa seafood, minsan sa ibang gamot, minsan pati sa powder ng gloves or sa mga pollen, insects. So these are unrelated to the vaccine. So this should not make you not go for the vaccine. Go pa rin at oobserbahan kayo para makita kung nagka-interaction kayo sa vaccine. There was a question, I saw kasi some questions na paano yung mga, di ba sa dengue merong question of nagkakaproblema. So that whole phenomenon about antibody-dependent enhancement, which was seen in dengue vaccines, is not expected to happen here sa COVID vaccine. Merong concept called reactogenicity. That means, di ba, magkakaroon ka ng, syempre, sasakit naman yung balikat mo. Minsan, magkakaroon na some reactions that are thought to be because you are reacting to the vaccine. So, ang most common dyan, yung headache. Ako talaga nagka-headache. Hindi ako madalas magka-headache, but I had headache after the AstraZeneca vaccine. But I didn't think it was bad kasi I knew it was a reaction to the mismo vaccine. So I actually welcomed it and knew that it was working for me. So these are the other reactions. So what happens kung may side effects? So sabi nga kanina ni Beth, you will be observed, tapos the sites will be ready with all of this para sure na maaalagaan kayo just in case you get a reaction. Okay, the next sets will be kung pwede ba. So, panay tanungin yung doctor nyo kung meron kayong mga iba-ibang karamdaman. So, let's say, nagka-shot ka for something else. Let's say, yung time na kayo ay ready na magpabakuna ay kaka-receive nyo ng flu shot. So, ang pag-itan nun dapat 14 days. Pwede naman, pero hintay ng 14 days para hindi masyadong malito yung katawan nyo sa reaction. No? So, may mga tanong na, pag isa lang tao nagpabakuna, parang magkaka-problem ba the rest of the household? So, walang ganong phenomenon din for the COVID vaccines kasi hindi sila live viruses. So, impossible for you to get COVID-19 from the vaccines or for you to pass on COVID-19 to others because of the vaccine. Walang ganon. It doesn't happen. Is it okay to get different types of COVID vaccine? So, isipin ko, Sinovac muna ma-receive ko ngayon. Tapos pagka nagka-Moderna, magpapaturok rin ako ng Moderna. So, ang sagot doon ay no, don't do that. So, vaccine brands are not interchangeable at this time. So, don't do it. Okay. Yung mga buntis, pwede ba magpabakuna? So, the answer there ng WHO ay huwag muna. Hintayin mo na lang after ka maka-deliver ng baby. So yan, based on the statement yan ng Philippine OB. What about yung mga immunocompromised? That means yan yung mga vulnerable na nakita natin kanina. So actually, pag-isipin mo, sila nga talaga yung dapat mabakunahan kasi vulnerable. So unless meron silang allergy, go lang. No? Talk to your doctor and make sure you are okay. But for most part, most immunocompromised, pati yung may cancer, the answer is yes. Talk to your doctor. Other cancers na nagkikimo, yes pa rin. Ita-timing lang yung bakuna. So it doesn't contradict your chemo. Yung mga nagsisteroids, the answer is yes pa rin. Yan, just discuss it with your doctor. Yung mga may autoimmune, may mga sakit na ang tawag autoimmune. No? So sobrang dami nilang, sobrang strong ng immune system nila. Or even illnesses like Guillain-Barré. So lahat yan pwede, basta your doctor knows. Pati mga HIV patients. So you heard kanina, sabi ni Bev, I take care of many HIV patients. As long as the CD4 count is more than 200, go lang. Pila na kayo sa vaccination program ng mga offices nyo. Kasi it will benefit you. Yung mga on blood thinners, fear lang natin dyan, baka magkaroon ng hematoma sa injection site. So aayusin lang yung dosing ng blood thinners, but yes pa rin with some precautions. And other comorbidities, yung sinabi natin kanina, may mga cancers, diabetes, chronic lung disease, chronic kidney disease. All the more, you really should try to get things under control. Discuss it with your primary doctor and line up for the vaccination program kahit hindi pa kayo senior citizens. What about patients with chronic infections? Kunyari, ginagamot for TB. So, ang answer pa rin ay yes. Pwedeng ibigay yung bakuna sa mga nagkagamot ng TB. In fact, kailangan siya talaga ng mga nagkagamot sa TB. What about kung may COVID infection ako? So, we saw maraming COVID infection sa PGH. Sabi namin, wag muna, hintay kayo. So, usually, hintayin matapos yung COVID-19. Yung current protocol ngayon ng DOH, sabi, 90 days. What about kung nagka-COVID ako before?
Doktora?
No? So,
Evening.
yes pa rin.
Ay,